Do you want to know how to reverse age, how to live longer, how to live better? Well, stay tuned for this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side, and between us, we have Naturopath Alvin Harbour.
He's still here.
They actually kidnapped me this time, so I can't say.
He doesn't know what he's in
we
for.
tied him to the chair.
Yeah, so this is actually the third episode we're doing with Alvin. And so if you haven't listened to the previous two episodes, please go back and listen to them. We introduced him 2 episodes back. But just a quick intro, Naturopath Alvin Harbour, he has a clinic. It's called IVOLV Superhuman Wellness Clinic, right? Mm-hmm. And he's located here in Peoria, Arizona. And just an amazing person. He and his girlfriend have this clinic and are helping so many people, including me. I've been going to them for the last 6 months and have just seen some really miraculous changes in my body and my life. And so anyways, we wanted to talk about this topic, and we're going to go ahead and just jump right in because this is actually a hot topic, right, Alvin?
Absolutely, yeah. Age reversal is a big one. Everyone wants to live better, longer. And how do we do that?
How do we do that?
Talk to us, Alvin.
Yeah, please.
So, what's your take on this?
So the number one killer in the world is stress, as we know, right?
Yes.
And then follow that up with a little bit of toxicity. So now we've just converted our entire biological system into this ticking time bomb. Mm-hmm. So how do we defuse it?
Yeah, I remember reading something in some of the studies that we were doing. It said that our generation would be the first generation that did not outlive our parents.
Yeah.
It's pretty scary.
It is scary. You know, I was talking to a guy he's the director of a very large hospital here recently, and he said he put 10 men under the age of 55 in the morgue that week.
Wow. Jeez.
So it's a scary place we live in, you know, as far as like what do we do? How do we do it? Because we're seeing, like, if you look at the internet, you'll see it, everything. Do this, take this pill, take this supplement, do this thing.
It's overwhelming.
It's overwhelming.
Yeah.
It's overwhelming. So you don't know what to do and you don't know who to trust.
Right.
So we came into this world of health and wellness to truthfully change the way it's seen. Everything that I wanted to, had a vision to build this clinic, and I knew that everything in there had to be transformational. Every phase of it had to be something that people came out with that aha moment where they truly felt different. And I tell people all the time, I create curiosity and wonder. Mm-hmm. And that's magic, right?
Yes.
So
yeah, a lot of people are doing things, especially taking supplements,
Mm-hmm.
and they don't even know why they're taking them a lot of times, or they're taking them and I'm like, do you feel different? Well, no, but I've been taking it for, my so-and-so told me to take it, and I've been taking it for 5 years.
Yeah.
But I don't feel like it's doing anything, but I'm still taking it.
Sure.
Right.
My grandmother's been on medication for high blood pressure for 60 years.
Wow.
She is now 95 years old.
Wow.
And the doctor has had her on the same medication forever.
Wow.
And a myriad of others. Mm-hmm. And who knows, there's no studies done on it to show the contraindications. So what do you do?
Right.
So I jumped into this. Like I said, we went into the world of longevity and how do we live longer, better? How do we really just wake up every day and feel fantastic? Because that's what I want. I really wake up every day and I'm like, I get to do this again. Mm-hmm. I just feel so blessed that I get to be in the position that I'm in to support people in their mission of how do I gain performance? How do I, if I'm a golfer, if I'm an athlete, if I just want to live longer, better, what are the things that I can do to support those people? So I created a system using light, vibration, frequency, and sound, and stacking that with hyperbaric oxygen to prep the body. We use supplementation as well with peptides. Now, peptides are really like they're a hot topic right now because
talk a little bit
explain
about those.
what it is, because
So-
I think a lot of people may not be familiar with that.
so there's a doctor from Russia. He's called the father of peptides, Dr. Kavinson. Okay, Dr. Kavinson started researching these naturally occurring peptides in the body. They're building blocks for proteins. They're just amino acids, the building blocks for proteins. So chained together, several amino acids make a peptide. Several peptides stacked together, longer chains of amino acids, they make proteins. The body turns proteins into new genetic material. Thus, we can make better genes faster, right? When given the right nutrient profile or the right sauce. So, and he was doing this research because he wanted people to gain performance and heal things, everything from liver conditions to pancreatic conditions to kidney diseases to cancers to tumor growth, anything. And he has spent his entire life up to age 85 doing this research.
Wow.
And there was a reason why, the Russian Olympic team won so much back in the early 80s, and they couldn't detect why. Because he had found the secret. And truthfully, peptides are the secret. And they're a piece of everything that we do in the clinic because we've seen the efficacy. They've seen how well they work to modulate the system in the way that we choose. So in adding peptides in, you can look at everything from skin health to biological health. So those two things are what everyone looks for. Like, number one, how do I feel better? Number two, how do I look better?
Right.
Or maybe it's vice versa. How do I look better first and how do I feel better, right? Because I could actually feel like garbage, and then if I look good, hey, no one knows the difference, right? It's easier to hide.
True.
So, and then we combine that with supplementation, and then once the body is prepped and ready, then we can actually implement pluripotent stem cells. And we've all heard that about stem cells before. We use something that's different than most people. We actually take the stem cell and we keep it whole. So whenever you go to other countries and you get stem cells here in the country or here in the United States, and they take your own stem cells and they'll spin those in a centrifuge and they pull out your stem cells. But most of the time it's separated, and they'll take out different pieces of it, right? So you lose a lot. You lose the full payload. So you won't get all the hyaluronic acid. You won't get the cytokines that actually protect those stem cells. You won't get the growth factors. You won't get the Muse cells in there. And the Muse cells actually help. They're so small that they pass through the blood-brain barrier. But keep in mind, your own stem cells are as old as you are.
Could you just explain, just in case there's some out there in our audience that don't know what stem cells are?
Okay, stem cells are reparative. They're basically they're like a mechanic shop with messages. So they go into the body and they repair everything. Now, your stem cells are programmed for you. You've heard of mesenchymal stem cells, okay? The MSCs, by abbreviation. Those stem cells come from umbilical cord blood. Now, where ours are sourced, we source them from first-time mothers, 18 to 27 years old. And they're from the healthiest moms in the country, up in Utah. All of these women are faith-based. We do a full family history, both genetics and a psychological profile on both sides of the family.
Wow.
So you know that they're safe.
Yeah.
We do genetics on them. We do epigenetics. We run metabolomics on them as well to make sure that there's nothing in there that could possibly be a trigger for some sort of adverse side effect. And we've seen everything from repaired joints to cognition increase to, truthfully, the reversal of Alzheimer's, the reversal of things that everyone says are incurable. And there's slowly, these studies are coming out where we can really show people that, look, you don't have to live this way. You don't have to live in pain. You don't have to live in discomfort. You don't have to live without that lack of cognition. You can truly repair it. And we have the tools to do so now. Now, the great thing about these mesenchymal stem cells is they're not programmed. They're what's called non-differentiated.
So they can be used on anyone.
So they can be used on anyone. Anyone. And I spoke to a gentleman the other day, and their child was born with cerebral palsy. They were not living with that diagnosis. They took him to Germany 3 times and received this same type of stem cells. his left foot was turned in, and his left hand as well. So the whole left side of his body, or maybe it was the right side. I'm sorry, take it back. It was the right side of his body was affected. Did you know that after they went to Germany and did the first round of stem cells, his foot turned straight?
That's amazing. Wow.
This kid at 22 years old just graduated from Clemson University. He was on the soccer team at Clemson, and he's on the Paralympic soccer team for the United States.
Wow. That's
Cerebral
awesome.
palsy,
Awesome.
born with no chance, and given no chance by anyone that had the powers that be. After using stem cells, changed his life.
So that would have been like 20 years ago.
Yes.
Wow.
So this stuff's been around for many decades.
Yes.
Why
Yes.
is it not used more, Alvin? Like why, I don't know, for example, in oncology, why is it not used more? I mean, I know that there are certain indications for it, but it sounds like it's something that could be used much more widely.
You know what's fascinating? A friend of mine, her dad has cancer, and her mom actually worked for Kaiser Permanente out in California, and they were able to use these experimental applications because she retired from there. So their medical was very inexpensive, if not free, and they did T cells and K cells and stem cells and all of these things for him. So it's being used.
Yeah.
It's just being used at such a executive level
Right.
that the general public they're not able to afford it, and insurance companies don't cover it.
To cover it, yeah.
Yeah, but there's a CPT code for it. I mean, I talked to several orthopedic surgeons, and they are actually they're cathetering the opening whenever they close someone up after doing a replacement or a knee surgery or a shoulder surgery or whatever, and they're implementing stem cells into the area to help it heal.
Wow. That's awesome.
Yeah.
So this is becoming a common thing now.
So then these stem cells, they're undifferentiated. So then when they go into the body, a person gets an injection, intramuscular or
Using intramuscular or intravenous.
injection. So do the cells just naturally go to areas where there's a need for repairing of the cells? Like where do they go throughout the body? Just everywhere?
Yes, so and that's why we spend so much time preparing the body. We're the only place that I've seen in the country, maybe even the world, that actually preps the body up front. And how we do it is just magical. I honestly woke with a vision on how we could create the best foundational platform for a body to receive stem cells. So, and that's what we do. We start with the process of reducing inflammation and activating these systems that are down-regulated, so that whenever we do introduce stem cells into the body, they're programmed to the area of absolute need.
Right.
So we can really get the best bang for our buck at that moment, right? So they're not spreading all over the world, all over the body, saying,
Because
"Oh my
there's so
gosh,
much inflammation.
there's so much going on in here. We can't possibly solve it all." So,
Sure.
and the stem cells aren't inexpensive. So we want to make sure that we're like snipers on them, right? We want a one shot, one kill. We're going to take care of this problem and get it over with.
So what's the protocol usually? You take someone through your protocols for so many months before you even introduce stem cells?
Exactly. Yeah. Our job is to research more, guess less, and then provide performance, not practice.
Okay. So how long, when someone comes into you for whatever issue, how long are they typically a patient of yours?
It could be anywhere from 4 months up to a year, depending on the level of inflammation in the body, honestly.
Okay.
And depending on the commitment level from the patient, because at the end of the day, if you commit to 65% of adherence to the protocol, then your time is longer.
Yeah.
And I'm a 95 to 100% guy. I want it all. If I'm going to spend something on it, I'm going to do it. I'm going to do it 100% if I can, if possible. I'm going to give myself a little bit of variance there, but I know that if I'm spending a good amount of my time and energy and finance into something that is supposed to change my life, I'm going to stick to it.
And then is the stem cell the last piece in the puzzle?
No, actually, then we complement the stem cell with peptides and nutritional support. So we're doing this. The nutritional supports, peptides, or the entire protocol. And then we add in the stem cells, and then we use certain peptides to help differentiate those stem cells and help them go to the right region.
Awesome.
And we'll use sound therapy as well to guide them to the area of need.
So how many
awesome.
how many stem cell injections does someone need?
It just kind of depends on the condition. Some people are 1 injection, some people are 2, some people are 3 to 4.
Okay.
If you look at people like Joe Rogan, he's been doing stem cells for the last several years. I think he's done over maybe even a dozen or 2 dozen stem cell injections.
Like once a year or every couple years? Or?
Well, and it depends on if you want stem cells for a condition,
Right.
then you could quite possibly you'll want them in that moment to get you over that condition. But also for anti-aging, age reversal, we can do micro doses, like 1 to 2 cc's every year to keep your body aging as slow as possible.
That's awesome.
That is amazing. Amazing. Oh my goodness, Alvin. We could go on. We could go on for a long time. This is such, I mean, I hope that you are seeing the amazingness, how awesome this is, what Alvin is talking about and what he has to offer. And if you are curious, which I hope you are, and you want to learn more, reach out to us, drlizcruz.com. Go to email us, support@drlizcruz.com. And and we will get you hooked up. Alvin is here in Peoria, Arizona. And
A lot of people travel out
absolutely,
here to go through his treatments.
Yes. Yeah,
We
he's
have
got-
people from all over the world come. So.
Exactly.
It's awesome.
Exactly. One of a kind. So please reach out to us. We will definitely have Alvin back. If you have not listened to the previous episodes, there's 2 more that we've done now with Alvin, and a lot of wonderful information. And hopefully, this is the beginning of several more, because it's fascinating what he's doing. It absolutely is. All right.
Thanks
so,
for joining us.
Yes,
thank
Alvin,
you guys for having
Thank
me.
you so much.
Yeah.
And we're going to go ahead and bring this to a close. Please connect with us, drlizcruz.com. If you want to email us, support@drlizcruz. And give us, if you haven't rated us, please rate us. Give us a 5. It helps other people just like you to find us faster. And if you have not subscribed, please subscribe so that you never miss an episode. Thank you again. We love you. We'll catch you on the next episode.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.